Okay, this is my persuasive speech on giving birth naturally instead of using an epidural. And this is the audience. So what if you guys planned to have your child and you wanted to have help, so you get help with the pain, so you get an epidural. That's some kind of medicine they give you when you have a baby. And when you're getting it, something goes wrong, and then you have to have surgery to have the baby instead. That wouldn't be good, would it? No. So, if that happened, obviously it would be against what you planned for. So an epidural is a type of medication. They use a needle and they put it in your back, and it makes the whole bottom half of your body numb. So then you can't feel anything when you have the baby. Then it doesn't hurt. What it really does is it blocks the nerve impulses from the lower spinal segments, causing a decreased sensation to the lower half of the body, so it makes you numb. When you are considering if you want to get an epidural or medication to help you with the pain, you should think about all the risks that are involved. So that might mean if it's harmful for you. You want to consider the best option for yourself and for your child. What's going to be the most beneficial for you?
I don't know.
95% of women could give birth, could have a baby without having any help with medicine. They could, but guess what? Only 25%, so that means a quarter of the people women would want to be able to do this, but only 2% actually do it. Women need to be more informed of all their options. So when you guys get bigger and have kids, you're going to want to know all the different ways you could have a child, right? Some people believe that it's easier on a birthing mom and her infant if the mother receives an epidural during birth. According to what I will disclose to you in regards to the negative effects of an epidural, the loss of some independence immediately after giving birth, and the benefits of having an all-natural birth, I believe you will consider giving birth without the use of an epidural. Some people believe that using medication when you're about to have a baby is the most beneficial for the mom and the baby. One of the only benefits that I found would be that you'd be able to be without pain, and therefore you could probably rest or sleep, and that way your body would naturally get ready to have the baby. However, the risks of having an epidural is that your muscle strength, your balance, and your reaction are all reduced. When you're about to have the baby, your blood pressure could suddenly drop. You might need IV fluids, medications, and oxygen. Some side effects would be shivering, ringing of your ears, a backache, soreness of where they put the needle in your back. You might feel nauseous or sick to your stomach, and you might have difficulty going to the bathroom. Although it is rare, you could have nerve damage, which would damage things in your back from where a catheter is inserted. And the catheter is something used with the needle to continuously give medications. Unnecessary procedures during labor, obviously they put the health of the mom and the baby at risk. Most moms look forward to being able to care for their baby right away, but when you get an epidural, you're numb, so you can't really move around. So a lot of it is on the nurses and the doctors to do a lot of personal cares for your baby and for you as well, because you can't even get up to go to the bathroom. Some of the numbness from the waist down lasts for 4 to 6 hours. The benefits of having an all-natural birth, although 50% of women usually choose to have an epidural, generally they take the easier way out, which isn't always true about it being the easier way, but they're in so much pain that they want to do that, and they don't always know all the effects of an epidural. They just want a relief of pain. When you have a natural birth, it allows you more bonding time with your baby. You have a quicker recovery because you're able to get up and move around, exercise, walk around with the baby. In this speech, I covered the effects of an epidural, the loss of independence, and the benefits of having an all-natural birth. More mothers should consider having an all-natural birth due to it being healthier for you and the baby. It's also more beneficial for the mom and the child. By having an epidural, a mother is putting herself at risk for prolonging her labor, being exposed to the potential risk from the epidural, and she should consider having an all-natural birth because she should have more independence and a faster recovery as well as more bonding time with her infant.